So with the RFID technology, we can exactly ensure that you get your garment the next day hygienically clean, delivered to your locker.
Public health. It's on everyone's mind these days, from hand washing to emerging pathogens. Welcome to Transmission Control, an infection prevention podcast focused on your appetite for trailblazing thought, discussion, and innovations that will help you make informed decisions. Each episode, we speak with public health experts and safety champions from across the globe as they share their experiences, passion, and opinions. From investigative journalism to medical publications, we tackle real-world barriers to halting the spread of disease. Whether you are tuning in for education, inspiration, or to hear the stories that need to be told, thank you for joining us. And now, get ready to blast off with your weekly injection of insight on transmission control.
This week on Transmission Control, we speak with Aniruddha Banerjee, Director of Healthcare for Lindström Group. And Larry, we're going to be talking about healthcare uniforms, scrubs. And as a nurse myself, I wore lots of scrubs throughout my career. But I never heard this term that we're really going to be introducing to the audience today, which is built around quality standards for the laundering of those scrubs and other healthcare uniforms. And that term is hygienically clean. And so I don't know how much I really understood about laundering. I knew there were, offsite services that were available, companies that could do this industrial. I think I washed every single pair of scrubs that I ever owned at home. And so
using your Tide detergent.
Yeah. And I feel like there is a high level of variability, and we are talking about, clothing that comes into contact with every single patient. So right. I think we're going to learn a lot today because I have never thought to this level of detail on the topic previously.
Yeah. And I'd like to get into the definitions that we've talked about: clean, disinfected, and sterilized of reusable materials, endoscopes, clothing. So I'm interested in hearing how hygienically clean is different from disinfected. And then we're going to touch a little bit on smart apparel, smart clothing, and what that is offering us for the future and how we might be able to track clothing and get a better understanding of the real extent to which contaminated clothing, like a contaminated stethoscope, a contaminated flexible endoscope, a contaminated anesthesia cart, how all of this ties in so that we really can start following up on these quality standards and making sure that we don't diminish the importance of the clothing that we're wearing as a vector for disease transmission.
All right. Well, stay tuned, and we're going to be right back with Aniruddha Banerjee, Director of Healthcare for Lindström Group. I'm Justin Poulin.
And I'm Dr. Lawrence Muscarella.
From 17 Studios, let's get into it. This is Transmission Control.
Joining us now is Aniruddha Banerjee, Director of Healthcare for Lindström Group. And Aniruddha, really appreciate you coming on. We found you on LinkedIn, where we're finding so many guests these days who have a really good message and something to say to our infection control preventionist audience. And so this is going to be a great topic, talking about having healthcare uniforms that are hygienically clean. And we're going to dive in here in a minute, and I'm going to tell you to define what you mean by hygienically clean. But before we do that, just welcome to the show. Thanks so much for giving us your time to come on and share your insight today.
Thank you, Justin. The pleasure is completely mine.
So why don't we have you talk about your background, your experience in healthcare, and really, specifically around healthcare uniforms and why you think this topic is so important.
Absolutely. Hello, everyone. I am Aniruddha Banerjee, an electronics and communication engineer and an MBA from one of the prestigious B schools here in India, bringing together 14 years of rich experience in healthcare and industrial automation, having worked in leading companies like Siemens, Vega Greischeber, GC, and now leading the development of global healthcare business here in Lindström, 175-year-old giant in the end-to-end rental textile services provider space. I am responsible for strategic development and management of Lindström service concept for healthcare and social care segments. As a thought leader and industry expert in healthcare, I am passionate about enabling healthcare and social care organizations deliver hygienically clean and smart textiles, resulting in an excellent customer experience.
So you just use that term, that hygienically clean, and I am going to have you define that here in a second, but let's make sure everybody knows exactly what we're talking about. So when we say healthcare uniforms, what are we talking about and what are their purpose, at least for the conversations of today?
Sure. So healthcare uniforms, when we look at the product portfolio, it's basically the nurses' uniforms, medical scrubs, lab coats, and jackets. So these more or less form the product portfolio surrounding the uniform space. So wearing uniforms helps in formation of a professional identity in healthcare. So standardizing uniforms makes it really easier for patients to identify who they are dealing with. That goes a long way towards creating a positive patient experience that results in less stress and more confidence.
You know, let me tell you, when I worked as a nurse, or I should say even before I became a nurse, I worked as a certified nurse's aide, right? And so then I went on and worked as a nurse for many years. It's been a while since I provided direct patient care, but for well over a decade, I was in scrubs every single day, and I would have to buy my own scrubs. And there were some, color, or I should say there were some standards around what color you should have or could wear. And even as a student, everything always had to be white, but it was still a little bit loose. And I definitely heard what you said just now about kind of having a standard so that the patients kind of know that you're a hospital employee, what your role may be in the hospital. But I also was responsible for washing my own scrubs. So I had to own them. I had to take care of them. I had to wear them into the hospital. And then you're throwing this term out there, hygienically clean. And I guess I need to understand what hygienically clean is, because just because I wash mine at home, does that make them hygienically clean?
Yeah, that's a brilliant question. So let me explain this with an example. We love a white, stain-free bedsheet. Our perception based on the look and feel is that it's clean. That's fine. However, is it hygienic? That's a question that we need to understand. So when we mention this term hygienically clean, it means both. So hygienic in terms of pathogen elimination and clean in terms of inorganic removal, like removal of the stains, odors, and providing an attractive appearance. So hygienically clean is an established threshold that guides the reduction of pathogens on textile products to a levels that pose no threat of human illness. So that's how we define hygienically clean.
So as far as the textiles, you just used the term textile. What kind of textiles are we talking about in terms of composition?
Yeah. So in terms of textile composition, if you see, there are various key factors in transfer of microorganisms from textiles. That includes the surface properties, the friction, and the moisture in the fabric. So these are the three most important things. More the friction, more the wetness, and lesser the roughness, more are the chances of transfer of microorganisms from the textiles. The greater survival of microorganisms on cotton compared to polyester and silk can be partly attributed to the moisture content of the different fibers. So cotton absorbs moisture to a greater extent than synthetic materials such as polyester, which supports the enhanced survival of microorganisms on this fiber type. So that's how the textile composition really matters.
So Aniruddha, I wanted to talk to you about two topics that you just brought up that I think are really interesting and that we should follow up on. You're talking about hygienically clean, and you said this basically is the elimination of pathogenic organisms. And then you talked about reducing these pathogenic organisms to quote-unquote safe levels. So let's go back a little bit to what hygienically clean means. When you say pathogenic organisms and the elimination of what type of pathogens are you talking about? Because we could go from those organisms that can be readily destroyed, let's say vegetative bacteria, we could talk about mold, and we could talk about very resistant bacterial spores. So when you say pathogenic, can you be a little clearer for our audience so that they know what hygienically clean means in terms of what specific types of organisms? And then I'll have a follow-up question.
Absolutely. So there are different kinds of bacteria when we consider on the textiles in the healthcare environment. There could be spore-forming bacteria, which, has a greater survival in the environment due to their resistance to desiccation, disinfection, and higher temperatures. There could be fungal pathogens, which also survive on various hospital textiles. And also the recent SARS-CoV virus has also persisted on cloth for 2 days compared to, 4 days on glass or on banknotes, on 7 days to even the surgical masks, stainless steel and plastic. So we are talking about a range of viruses here. However, to attain a hygienically clean environment, a laundry must deploy certain best management practices and pass bacteriological testing and facility inspections. What do we mean by it is that there are certain standards in place which allows, say, a pass-fail criteria of less than or equal to 20 colony forming units, or what we call a CFUs. So there are certain recommendations in place to define how you achieve a hygienically clean certification.
Okay, and so then that would answer my second question, which was the levels that are safe. You've come up with this 20 CFUs, and 20 CFUs of what? Vegetative bacteria? What type of organisms are you talking about that would be those 20 CFUs? I mean, they wouldn't be bacterial endospores like C. diff, Clostridium difficile, correct?
Total aerobic microbial count of 20 CFU or less per square decimeter.
Okay, very good.
So, Aniruddha, we were just talking about like home laundering and, having minimum standards. I'm assuming that if you're home laundering and you talked about colony forming units, like there's no way to measure that with home laundering. Does that leave a pretty big gap in the industry?
Yeah, the word is not big. The word is huge. So in terms of home laundering, if we look at the entire picture, why is it so risky? So by taking their uniforms home, workers run the risk of contaminating their own home environment, including the washing machine, because unlike in-house or industrial laundries, there is no segregation of the laundry based on designated soiled areas or clean areas. So that means if the virus is on the uniform, it could transfer onto the other surfaces or other items of clothing in the wash. So first is the transfer risk. Second is the risk of cleanliness. So laundering scrubs, uniforms, the recommendation is that from the CDC side is it should be at least 71 degrees centigrade for a certain 10 to 15 minutes time. However, what is being noticed is that in home washing, you can achieve only 60 degrees centigrade. So the challenge is if you can't achieve that recommended temperature reading, then the virus would not get eliminated. So quoting from one of the white papers from TRSA, a Bioscience Laboratories Incorporation study found significantly greater contamination among home laundered attire than scrubs laundered by healthcare facility or outsourced for laundering. So there is enough data to suggest that it's very risky to do a home laundering procedure for the medical scrubs. Can management be certain that employees follow the laundering directions? Do we do home audits? We don't, right? So it's very difficult. You just go forward with the belief that the employees are following the processes, which is pretty risky.
Aniruddha, very good point. So I want to back up a little bit and just explain for myself and the audience what type of laundering we're talking about. So we have home laundering, which you just addressed. We would have on-site, let's say, hospital laundering, and we might have outsourced laundering that the hospital might contract with the company for what we could call third party. So are those the three? And then I have a follow-up question on that. But is there any other description for laundering of the uniforms that we would talk about other than at the home, at the hospital, or at a third party?
Yeah. So Larry, you hit the nail on the head. It's absolutely, these are the three possibilities. Either you do the home laundering or it's in-house or it's outsourced, third party laundry. Yeah.
Okay. So you described some problems with the home laundering. And we're talking about, I guess, correct me if I'm wrong, but there probably would be some standard that maybe the water temperature, let's say, for example, if the water temperature was 110 degrees Fahrenheit in the home, and maybe in a third party it was, let's say, something much higher, like 160 degrees Fahrenheit, we can see there's a discrepancy there. And I think that was to your point that the home laundering may not be as effective as maybe a third party site. So is there a way of compensating for that temperature? Sometimes in the reprocessing of reusable instruments like endoscopes, we can start tweaking concentration to compensate for temperature. So to be specific, 2 points. The first one is, might we add a disinfectant at home to compensate for the lower water temperature, make up for it, and still kill the organisms? And if so, can you address maybe the issue of compatibility of the uniforms with the bleach?
Absolutely. So basically, there are two ways. Even if you are not able to reach the desired temperature, how can you still look at eliminating the bacterial levels? So bleaching has been found to reduce microorganisms found on uniforms that were home laundered. But this may not be a routine practice. This is something that, we need to understand. Also, some studies which were done in the washing uniforms, it was seen that after decontaminating with proper drying and ironing after the wash, it's another practice which could reduce the bacterial levels to a certain extent, but it's not consistent. It's not an everyday affair that we do bleaching and then ironing. So that's a risk.
Let me just say there is no way that I was doing that. And I'm not trying to be silly about it. I'm just saying, if you're working a 7 to 3 shift, I very rarely would have thought to do all of that the night before, the scrubs I'm going to wear the next day. And there's definitely no way I'm getting up in the morning and doing that.
And ironing your clothing.
And that was before we had kids, right? Once we had kids, and there's really no way for anybody to validate that the staff are doing that and on such a large scale with so many people wearing scrubs in the hospital. I can see where, quality control just will escape you with home laundering significantly. But I also know that the clinicians might have an attitude about whether or not they're really wanting to deal with either of the other two options for laundering scrubs, right? They might want to have their own scrubs. They might want to have their own colors or, whatever they've bought. So how do you find that clinicians typically respond when they're told they can't launder their scrubs at home anymore if a facility were to make a decision to do something offsite?
Yeah. So I think there are two answers to it. One, consumers and healthcare providers, they support pro laundering. There is enough evidence in terms of surveys. So I'll just give you an example of a survey done by TRSA in 2017, where they did a survey with around 1,400 infection prevention experts at healthcare facilities. And it was almost unanimous that around almost 9 out of 10 had the belief that the wearing healthcare garments at home presents an infection or contamination to the outside. So it's very clear, it's very evident. Now, the second part of the question, how do we ensure that your scrubs again reaches you next day hygienically clean? So I think there is enough technology that has come in. We now talk about smart textiles with RFID technology inbuilt, where we can clearly identify the garment belonging to Justin. So with the RFID technology, we can exactly ensure that you get your garment the next day hygienically clean, delivered to your locker.
Oh, that's really interesting because, I know Larry did a good deal of research like leading up to this and looking for, some instances in the news, about challenges in laundering just in general, whether it's home or industrial. And Larry, I don't know if you want to speak to any of that, but I'd like for you to kind of talk about some of those. And then Aniruddha, maybe you could back that up with some research, because I've never heard of the RFID option, but it really does allow for personalization, while you still are able to manage, those quality standards that you're trying to have, established in the industry. But Larry, I wanted to kind of tee you up for some of the things that you found in your research first.
Yes, thank you, Justin. So I had two kind of questions, comments, looking for some follow-up answers from you. And the first thing is we'll go with the smart uniforms. You talked about that with the means of tracking and kind of assuring that Justin would have the uniform that was for him. I'd like to talk a little bit about, in terms of smart uniforms, what might be done in terms of how these are, maybe we could call these engineered fabrics as well. But one thing before I get to outbreaks that occurred across the country in the last couple of years, I wanted to know, to tie a loose end, if you could just discriminate for me, and I'm sorry to digress for a second, but it will lead me into my next question, why we are talking about hygienically clean as opposed to disinfected apparel, textiles, clothing. You had said that hygienically clean meant that we were reducing the number of bacteria. You said 20 colony forming units. The first thing is that per square centimeter or is that per entire item? And the second thing is why do we call that hygienically clean as opposed to just low-level disinfected? And then I'll get into some of my questions that Justin was asking me about in terms of some linen outbreaks that occurred across the country that I think our audience would be really interested in hearing, and maybe you can talk about a little bit. So back to hygienically clean versus disinfected, what are those differences?
Yeah, I think disinfectant is a term that is just used to achieve a certain level of bacterial formation allowed on a textile. So you can say that, through disinfection, we achieve hygiene. So what is the end product in mind? The end product is hygiene. Disinfection is a process. So that is why, considering the end in mind, we have termed it as hygienically clean garments, not disinfectant.
Okay, excellent. So disinfection is the process, and maybe hygienically clean then is the outcome of that process. Okay, that's Absolutely. Fantastic. Thank you for that. Okay, so in preparing for this, I came upon two cases that aren't directly related to the issue of uniforms, but I think it carries over into uniforms. And that is in 2009 and in 2015, in two cities in the U.S., there were a number of deaths and infections that were attributed to contaminated linens. So linens are in contact with the patient as opposed to maybe the apparel is in contact with the healthcare worker. But there's some similarities there. So I want to focus a little bit on this whole hygienically clean and whether this is more of a theoretical concern or an actual concern. So maybe you can talk about whether we have identified outbreaks directly linked to contaminated apparel. But before you do, maybe you can comment a little bit on this issue of linens, where if the audience didn't think or thought maybe this is all kind of theoretical, we do actually have patient and adolescent deaths in a children's hospital that were linked back to outsourcing the linens, and then the linens through some means and somewhere along the process were becoming contaminated with the mold that was in contact with the skin of the immunosuppressed patient, and we had actual deaths. So this is a real issue and a real concern. Can you maybe touch on that a little bit and maybe discuss how that may translate into your smart textile, which would be designed to prevent that, and whether we actually have outbreaks linked directly to contaminated healthcare workers' apparel and clothing?
Super. I'll answer the second question first. So just taking a reference, I'll give you an example of a Connecticut hospital which found that if a worker enters the room of a patient with methicillin-resistant Staphylococcus aureus, which is popularly known as the MRSA, this bacteria is transmitted to the worker's garments about 70% of the time, even if the person never actually has touched the patient. So if the worker doesn't change into street clothes before leaving work, the risk of this bacteria spreading to the outside world increases. And even MRSA cross-contamination has been found in the home environment. So it's pretty clear that, exposing households to contaminated uniforms can be a threat.
As well as immunosuppressed patients in the healthcare setting, not just in the home setting.
Absolutely.
That's a really good point.
So can you comment a little bit on the contamination of the uniform and how that has actually resulted in cross-infection in the healthcare setting? I mentioned earlier that we have documentation of that happening with linens. Maybe you can talk a little bit about linens, smart technology used in linens, or how this might apply to healthcare workers' apparel and uniforms.
Yeah. So regarding the linen question, linen in a healthcare laundry, which follows the complete hygienically clean process, ensures that there is no cross-contamination or recontamination of the textiles at the laundry, as well as till it reaches the hospital's central collection point. And the RFID technology inbuilt into it ensures that at each stage of the process, it's properly well documented, and randomized microbial swab testing is done at the laundry to ensure that the product is actually hygienically clean delivered to the hospitals. Even at the hospital's end, we can do microbial swab testing to ensure that the products reaching the patients is hygienically clean.
So this is crucial. Is there a standard or a requirement, at least from the FDA standpoint, that the facility is sampling that linen, those apparel, to make sure they're meeting a standard? Is this done randomly? Is this done on each piece? Is it a requirement? And then when the hospital receives it from this third party, is the hospital's policies and procedures requiring that it be performed? In other words, we can talk about theoretically that it can be done at the industrial site or at the third party, and that it can be done at the hospital upon receipt. But I want to know, is it actually done?
Yeah. So if you want to achieve the hygienically clean certification from TRSA, it's a must that you have to do periodic randomized microbial swab sample testing, and reports have to be preserved. At the hospital's end, it's a responsibility of the internal audit team to do it, and hospitals who follow the processes really do it at their end.
Very good.
So, I mean, ultimately, what are the benefits of doing industrial laundering and really hitting some of these, quality standards that you're talking about, Aniruddha?
Right. Does it actually reduce the infection rate? Do we have some type of data to support that? Good point,
Right.
Justin.
Yeah. So contracting with a hygienically clean healthcare certified provider ensures that all the textiles used in a healthcare setting, whether it be, your healthcare uniforms included, have diminished presence of harmful bacteria. So you need to follow the risk analysis and biocontamination control, or the RABC compliant standards. These laundries subject their facilities to inspections that verify their laundry processes and microbiological testing that quantifies laundered garment cleanliness. So it's 3 steps: prevent, monitor, and document. All 3 components at your fingertips.
And who's doing those inspections? Is that done by the FDA or depending on the country?
Yeah. So it depends on the country. In Europe, it's done by the ETSA, the Laundry Association. In US, by the TRSA, as well as the customers also are responsible for doing their own audits of the external healthcare third-party services provider.
Okay, and as we wind down now, and all of your insights have really been educational for me, as we wind down, can you speak a little bit to the issue of the COVID-19 pandemic and how this plays into your smart technology, into the textiles, or whether the virus vis-a-vis the textiles and cross-contamination is really a moot point or a real point?
The emergence of COVID-19 pandemic has increased the need for rigorous infection control, including effective decontamination of potential fomites in the healthcare environment. Having said that, though the focus on hygiene overall and in the healthcare environment has improved substantially, still laying down strong infection control processes, discouraging home washing, and adherence to the same is something that still needs a lot of improvement.
All right, so let's paint a picture for the future. This is the last question, and then you can take a breath. We've been really firing them at you today, but this is incredible information, and honestly, something I never thought about until I saw your post on LinkedIn. So, And even the whole RFID and the ability to bring smart technology into the equation is just something I never would have envisioned on my own. So that means if you're that far ahead of me, I'm sure you've got a vision for the future that is even that much more far ahead of anything that I've really ever thought about when it relates to healthcare uniforms. Can you paint that for us? Tell us what the future looks like.
I am pretty optimistic about the future. So healthcare organizations around the world will slowly understand and appreciate that the risk of spreading infection is significant enough to warrant the expense of professional laundering. We need to make these investments for our safety of our own employees. In the future, most of the countries, if not all, would require healthcare service providers to launder and provide clean garments to healthcare workers. So employees change into hospital provided scrubs when they arrive at work and even wear sanitized footwear also provided by the hospital. At the end of the work shifts, employees change back to their street clothes before going home.
I'll tell you, I got to leap off. You just brought up something that we didn't talk about, which is footwear. But my very first sales job was with a company that supported sterile processing. And one of the things that our owner said at the time was, you might put on those blue booties and cover up your shoes, but you really need to not wear those inside of your home, right? Because the floors, they're some of the dirtiest floors, in the hospital. And, your young kids can be playing on the floor at home. Like, he really encouraged us to leave the shoes at the door. So I'm not going to go down a whole new topic as we're wrapping up this interview, but really just having a conversation around footwear that runs parallel to this conversation today. I'm really glad you mentioned that, because I think it's a critical next step in talking about healthcare uniforms and preventing infection. But even from this perspective that we discussed today about bringing this to your home. And I think that's an angle I didn't anticipate us walking through. And so I want to thank you for all your insights today, Aniruddha. You did a really nice job in this interview. Keep putting out the content on LinkedIn as more comes up, tag transmission control in your posts.
Thank you. And it was a real pleasure discussing on this very key topic with all of you. And hopefully this will create a lot of interest among the healthcare fraternity to take this very important step in the right direction. Thank you.
Thank you.
That was Aniruddha Banerjee, Director of Healthcare for Lindström Group. And Larry, there were some really cool themes in here. And when we set up this interview, I was really thinking more about having these quality standards in place and just seeing such an opportunity for that with healthcare uniforms, and hadn't really ever thought about what that might look like logistically, having worn scrubs for nearly 2 decades of my life, working as a CNA and a registered nurse over the years. And also, though, bringing those home and what that potential risk is, to your family. And that's something that when I moved into a sales role, because I would be going from facility to facility and then back to my house, that I started to become a lot more aware of, as in terms of like what kinds of risks I might be bringing home to my children. And I hadn't really ever thought of that before. But I think at the end of the day, as we started to go through this, I didn't realize there was technology that might be behind it. And I didn't realize, smart technology, which was a total surprise, I think, for me, because, you can set quality standards, but how do you measure quality standards? And, how do you do that consistently and in practice? And so, I think under my home laundering days as a clinician, as a nurse, that I would never have even imagined that you could implement something like that. And I also think it's just so important because these uniforms, and I'm going to focus on scrubs just because that's what I wore, but I know, he mentioned lab coats, et cetera.
Right.
But these scrubs touch every single patient. If you are a direct care provider in the hospital, they touch every patient, and then they touch the next patient on your caseload. And, I think it's really important as we talk about ways to improve, especially under the Accountable Care Act, healthcare acquired infections. I mean, they talk about fomites. You're taking it from one patient to the next patient to the next patient. how we haven't looked at quality standards on uniforms with a much more laser focus in the past is actually kind of shocking to me.
Right. And we talk about PPE, personal protective equipment, and that is to prevent transmissions. But if we're wearing the same clothing from patient to patient to patient, that which is to prevent transmissions could actually become colonized or just contaminated with organisms. And instead of preventing transmissions, it would be cross-infecting. So we talked today about kind of the smart versus, if you will, dumb apparel. And with the smart, it's interesting, kind of with the world today, endoscopes, for example, are tracked. So if we have an outbreak, we can track the actual patients who might have been exposed to a contaminated endoscope. We can track the endoscope to the patients. And it seems now, as we're moving forward with the uniforms, we can have smart uniforms with radio frequency identification or RFID tagging. We can actually track a contaminated uniform to maybe a downstream series of patient exposures and patient infections. That's fascinating. The distinction between hygienically clean and disinfected clothing is fascinating. It's something I never really would have thought of. And then we get into this whole issue about what is the value of the smart clothing, the apparel, the lab coats. And this brings in the issue where we go from the theoretical risk to the actual real risk of cross-infections in the healthcare setting. And I think as we start tracking more and more of the smart clothing, we'll see that these contaminated uniforms are really more of a problem today than we even realize.
Yeah, I think just having access to that data and then it can become actionable, and that's what drives process improvements.
Exactly. Yes.
100%. All right. Well, this was a great episode and a great discussion. Far more interesting, I think, Larry, than I even thought it might be. And
I was thinking this might not be the most interesting topic to cover and talk about, but I did some preparation to steer it into our wheelhouse.
Yeah, and then it turns out to be one of the better podcasts we've done. We're going to continue to look under those stones and try to find valuable content for the audience. So we appreciate you just continuing to subscribe to Transmission Control and listen to these podcasts. That's going to do it for this week's show. But as a reminder, you can support us by subscribing on Apple, Amazon, or Google Podcasts. We're also on Stitcher, iHeartRadio, Spotify. And if you search for Transmission Control, you'll find us on your favorite podcast application if you're not using one of the ones I just mentioned. You can also access bonus content for certain episodes by downloading our smartphone application for iPhone and Android. We certainly appreciate a rating and a review because your feedback is important to the show. And on behalf of Larry and myself, thank you for listening to this week's episode of Transmission Control.